There is a direct physical cable connecting the human brain to the heart. This isn't a metaphor. It is a tangible biological circuit. The American Heart Association recently added depression to the list of major risk factors for coronary artery disease. On this scale, depression sits equally alongside hypertension, high cholesterol, and diabetes as a primary predictor of heart failure. This connection is governed by the dorsolateral prefrontal cortex. Normally, it acts like a coach, regulating deeper emotional regions like the cingulate. In a depressed brain, the hierarchy flips. The deeper emotional regions govern the prefrontal cortex, allowing the players to dictate the coach's strategy. This conflict generates a stream of spontaneous electrical noise. It is an erratic signal that originates in the brain and radiates throughout the body. Addressing this condition requires us to look past abstract mood and treat the physical, misfiring electrical system. The circuit begins at the brain's surface, specifically within the dorsolateral prefrontal cortex. The tract then distributes downward through the anterior cingulate, insula, and amygdala. The final leg routes into the vagus nerve, terminating directly in the heart. Because this is an electrical circuit, we can influence it with applied physics. We can use electricity to correct a system that is no longer responding to ingested chemicals. This utilizes Faraday's law, the principle that a magnetic pulse can induce an electrical current in conductive substances, like the tissue of the brain. This allows for a highly targeted intervention. We can bypass oral medications and send a signal directly to the corrupted circuit. This is the role of transcranial magnetic stimulation, or TMS. It delivers focused magnetic pulses into the exact prefrontal region we mapped. These pulses pass through the skull to depolarize the neurons on the brain's surface, essentially jump-starting the control center. Think of this as high-intensity exercise for the brain. By repeatedly firing this region, we strengthen the prefrontal cortex so the coach can regain control over the deeper regions. Standard TMS is typically applied once a day for 6 weeks. However, the Stanford SNT protocol condenses this timeline into a single week. This relies on spaced learning theory, much like cramming for a test. The brain retains information more effectively when it is reviewed every hour rather than once a day. By stimulating the brain for 10 hours a day over 5 days, doctors can deliver the equivalent of 7.5 months of standard treatment in less than a week. This density forces the system to internalize a new physiological memory, training the control center to turn on and remain active. Following this 5-day protocol, between 60 and 90% of patients reach full clinical remission. For many, their depression scores drop to 0. Patients often report a sudden, total presence in the moment, a state of mindfulness achieved through circuit recalibration rather than drugs. This represents a shift away from the era of Psychiatry 1.0, which was defined by Freudian talk therapy and the analysis of childhood trauma. It also challenges Psychiatry 2.0, the era based on the chemical imbalance theory and a reliance on daily antidepressants. The circuit-based approach, or Psychiatry 3.0, treats these conditions as electrophysiological issues that can be targeted and corrected at the source. This suggests that depression is not a permanent character flaw or an unchangeable chemical state. It is a system that can be retimed. Severe depression shares the characteristics of a cardiac arrhythmia or a broken bone. It is a structural, physical misfire, and we are finally developing the engineering required to address it.